Welcome back to Out of the Rough. I'm really pleased to be joined by Sue Brophy-Wagner, the owner of Professional Credentialing Services.
Nice
it's a mouthful, I got that right? Yes. And Susie Bayer. Susie Bayer is the Director of Client Relations. So welcome to the show.
Thank you.
Very involved in the Chamber of Commerce, very involved in so much. And so tell us specifically what you do.
I keep the doctor's paperwork in order so that the doctor will take your insurance company.
Yeah, so you help facilitate the paperwork from the doctor to the HMO or PPO or the individual that's paying the doctor, correct?
Correct.
And you can imagine there's a lot of paperwork involved in these applications.
Yes, there's a lot of paperwork. Their Medicare applications are at least one form is about 90 pages long.
Oh, so you help organize all that.
All of that, yeah.
That is absolutely critical. Now, Susie, who normally contacts you? Now, is it usually the office manager, and is it a certain service you provide, a service industry you provide? Who normally contacts you for services?
Well, that's a good question because we have clients of all different specialties in the medical field, anywhere from dentists to chiropractors to acupuncture to general surgeons. And they usually are calling us because they're not getting paid properly or their office manager is piled under paper and needs help because she can't do it all.
Yeah, and that can be frustrating because the doctor performs a service expecting to get paid, but the paperwork's not quite in order because the person doing the paperwork has got so many other tasks.
That's correct.
Yeah, and that's you help bring all this together.
That's right.
Yes. Now, so what's the difference between that and credentialing and billing, for example?
It's actually, there are two different functions. With credentialing, you have to fill out an application and you send an agreement in. And more or less, if you want to use a different term, they sort of get a membership, if you like, to the insurance company. The agreement says that they agree to pay, or for the insurance company to send them so much based on what they are, the fee schedule is what it's called.
And a pre-negotiated fee schedule.
Exactly. And then with the company or the organization or the doctor's office bill. But if one is in order, the other one will not be. And that's when, like Susie was saying, the doctors might call us and say help because we're losing money.
Yeah, we're losing money because we're not getting paid on time.
Yeah, and then the patients start complaining because they're not getting, they're having to pay out of network costs.
You know, interesting thing, what's the #1 insurance company that normally is requested for help?
Absolutely, hands down, it has to be Medicare. With Medicare, you send out this huge application, and if you don't send all the paperwork in correctly, Medicare can turn around and send it back. And that means that it could take at least a month to get back. And at the average time that it takes to complete an application or for them to accept, it's 3 to 6 months. But it could take a month for them to get it back to you, and then you have to do over. So it's Medicare is probably the top one.
Yeah, and you help facilitate. That's what they talk about. They talk about the paperwork, the mounds of paperwork involved in Medicare, and you help facilitate that for the doctor.
Absolutely.
Yeah. So, Susie, you must get a lot of phone calls. Do you find that doctors will have you handle all their different, insurance, their different HMOs or their different carriers, or actually the doctor? All of them, or is there certain ones that normally are requested?
Our contract is based on an annual contract, and it's unlimited amount of insurance companies. So usually the doctor supplies us a list of all the different insurance companies they want to be with: Medicare, Medi-Cal, Blue Cross, Blue Shield, United Healthcare, just to name a few. And then we take care of making sure they're set up properly with each insurance company the way they want to be. Some don't want HMOs, some want just PPOs, some want just fee-for-service. So we do what the doctor requests.
You know, what's just amazing to me is you specialize in something that you've broken down to be relatively simple, but to the average, I would think, doctor who's trained to save people's lives, to prescribe better health, isn't trained for this if you will, this mountain of paperwork. And so it's so specialized what you do. Those that are watching this online, how do they reach out to you so they can find out more about your services and help get them out of the rough and if you will, into more success with their billing and their the back office? Yeah,
the back office, or some doctors, depending on the size of the practice, have billers, and billers are keenly aware of what's going on, what's going wrong. And so they can reach us at our website, which is www credentialpros.com.
Credentialpros.com.
Correct.
And we can also see you around town,
Yeah.
volunteering for so many different things involved in the Chamber of Commerce, among other nonprofits. Real quickly, phone number.
It's 661-298-2541.
Perfect. So that was Sue, I'm going to get this right, and Susie, so I don't get too confused. Sue and Susie from Professional Credentialing Services. We're going to jump to a quick break, and we'll be right back.